So you've just been diagnosed with PCOS, and then you go home to kind of do some of your own research. And then all that's popping up is blood sugar control, blood sugar balance, insulin resistance. And maybe this wasn't even a top conversation piece when you were first diagnosed. And that's because insulin resistance is not part of the diagnostic criteria of PCOS. Yet it's something that's fairly common in people that have PCOS. On the flip side, not everyone with PCOS has an issue with insulin. And so I think this conversation is really important that we start off in a grounded place with clarity. Because just because your labs are normal or it hasn't totally been flagged doesn't exactly mean that it's normal or that your insulin sensitivity is ideal. So, why should you be thinking about this? Sometimes insulin resistance has no symptoms at all. Other times, people will start picking up more subtle symptoms like you're feeling a bit off, you're kind of tired after meals, you are having some really strong sugar cravings. Now, these symptoms are not exclusive to insulin resistance. So it's not a perfect test, but it's sometimes some things that we see associated with it. So in this video, I'm going to help you kind of understand what the insulin spectrum looks like so that you can have more confidence on where you might land in that process or what information that you have. I'm Dr. Mélanie DesChâtelets. I'm a licensed naturopathic doctor in British Columbia, Canada. I have my prescription authority and I have access to labs. And so for over a decade, since 2010, I've been supporting thousands of people navigating PCOS and metabolic health. I teach both to the public and also to other clinician doctors who want to detangle PCOS and metabolic health. This video is for educational purposes only. If I happen to also be your naturopathic doctor and something comes up for you, let's loop in what came up for you at your next visit so that we can look at it through the lens of your individual health. And that's true for everybody else too. If something pops up and resonates with you, then make sure you circle back to your own healthcare team who can individualize the information for you. Also, I just want to make it super obvious that this video is focused on metabolic insulin resistance, and I am not talking about autoimmune diabetes like type 1 or late onset autoimmune diabetes either. That's a completely different mechanism. That is your immune system attacking the pancreas, and it's a completely different conversation. So if that's your journey, this isn't the video for you. And I just want to say that ahead of time. So by the end of this video, you'll understand where you fall on the insulin spectrum, learn the difference between insulin resistance, glucose tolerance, and type 2 diabetes, and know how to interpret labs like homa-ir, fasting insulin glucose, or the oral glucose tolerance test, as well as cholesterol panel ratios that give us a hint there too, and also why blood sugar habits matter even if your numbers look normal. So let's go. Up to 60 to 80% of people with PCOS have some level of insulin resistance, but not everyone. There are things that make it more likely, like depending on which criterias you met when you got diagnosed, your phenotype, that makes a difference, your body size, your ethnicity, your genetics. And that's why we don't want to treat everyone with PCOS the same way. We want to assess what is true for that person. Think of insulin resistance like a foggy glass. Just because you don't see it clearly in your labs doesn't mean it's not there and that it's not impacting how your body communicates with sugar. So, two, I want you to think about insulin sensitivity on a spectrum. I think as a human taking charge of your own health, that's a lot more helpful for us. Of course, when it comes to the clinician side of things, we like cutoffs and guidelines. And yes, you have it. No, you don't. But the truth is, we do know that it's a slow progression. And if we can kind of figure out where you are on that spectrum, then we can have so much more time to proactively do the work. Also, if you wait till you're in a later stage, just the fact that your body's in a high sugar standpoint, that you have high sugars in your blood, is actually quite damaging for the pancreas. So even if at that later stage you decide, like, I'm all in, I'm going to make these lifestyle changes, I'm going to start exercising, your pancreas might not recover in the same way that it was able to if you had done those exact same changes earlier on. So that to me is the really big reason why I don't want to wait and congratulate you. Oh, congratulations, your pancreas is really damaged and is really struggling to do this on its own. I want to have the opportunity to coach people early on and have breathing space to know, you know what, this isn't going to move really fast. So we have time to kind of coach and grow and develop skills and mindsets that will help you improve your relationship with blood sugar in a long run. So let's think about it as a spectrum. Now, we have diagnostic criterias for type 2 diabetes when we would label someone type 2 diabetes, or glucose intolerance. In insulin resistance, we have more variable definitions and cutoffs, which is one of the iffy parts about insulin resistance. Even in studies, they'll use different cutoffs. I know, not ideal. And then we have normal insulin sensitivity. So let's think about this as a spectrum. Normal insulin sensitivity, you have a really efficient system. Your body eat food, there's a sugar spike, your body handles it really well and efficiently with not much work, just the right amount of work. Once we start trending towards insulin resistance, your body is still able to get the job done. But instead of having the same amount of insulin workers doing the job, it needs to recruit like a much bigger team to get the same job done. So we see that your body is having to work really hard. This is what insulin resistance looks like. Insulin isn't as reactive or giving the same strong signals as it was before. Then eventually we progress to glucose intolerance. And that's when we start to see blood sugar and blood work struggle, but only after we challenge it. It's like if we were just going to check, we probably would miss it. So, what does that look like? That looks like the oral glucose tolerance test. And so, if you're someone who's ever been pregnant and who's ever done the sugar test, the 2-hour test, this is what they were looking for. They were going to see if your body struggles after we give you sugar, because that highlights that your body is starting to struggle. And eventually, type 2 diabetes is when we see that your blood sugar is high in your blood. So at this point, insulin is just not able to keep up and sugar is too high. And when that happens, that's associated with a lot of other independent risk factors. So that's where the spectrum kind of goes. Now, in the PCOS guidelines, I want to be clear that they do recommend people in a larger PCOS body at diagnosis to get an oral glucose tolerance test at diagnosis so that we get a baseline. Then it's recommended to do it when you want to conceive, you're thinking of starting to conceive, and then again during pregnancy. Those are some critical moments that in the guidelines are recommended that an oral glucose tolerance test is done. Now, in the guidelines, they don't recommend doing insulin resistance testing. And there is some rationale there. One, that testing isn't as reproducible, meaning when we're looking at it in a research setting with big numbers of people, that variation, it kind of quiets that noise and we see an average. But in an individual person, we really need to take your insulin resistance score with a grain of salt, because things that you do kind of close to that test or even the lab that you went to go do it at can have an influence on your value. So, can it give us a hint? Yes. But we can't compare each test to each other with like, this is exactly perfectly the trend. That being said, I think for the right person who understands that caveat, who understands that nuance, and would still really like to kind of understand how hard their body is working, with the right context, we can kind of get a bit of a sense of like, is there a lot of insulin to do the job, or are you doing it kind of efficiently, at least in a big ballpark kind of way? And as long as you understand that, then I think that is something that you can consider doing with your healthcare provider. The other one is we can look at the cholesterol panel. And so when we have insulin resistance, it actually impacts your triglycerides to HDL ratio. And so there is some research that has linked triglyceride to HDL ratio over 2.5 to insulin resistance. It's a bit of an indirect way to assess insulin resistance, but a lot of people will have a cholesterol panel already done. It's certainly not a diagnostic cutoff, but it might be available to give us a little bit of a test. So I guess what I would say is, because we're not talking at this point of like often medications and all of those things, I think with the right context and the right nuanced conversations, we can take labs that are a little less imperfect to kind of get a bit of a flavor, as long as everybody's on the same page that we know that that's what we're doing here, and that somebody would have the emotional capacity to kind of understand that and it wouldn't be anxiety inducing. I think it's a really great empowerment part, because it means like we are catching things at a very, very early change. And, we know that if things, if lifestyles gets worse or progress, there is a good likelihood of progression. Not everyone will progress. We don't have a crystal ball. It's obviously a few things, but we do know the things that we can do that will help to reverse that or halt that. And they are much more powerful in earlier stages than late stages. So, lastly, and maybe why also the PCOS guidelines go this way, they're like, well, you don't need a diagnosis to start caring about your blood sugar. But I have seen that for some people, it can be a strong driver of behavior change because it makes the invisible visible. And so I think you have to do a self check in with your healthcare provider, whatnot, if that can be helpful. Now, the thing is true though, that even if you have normal insulin sensitivity, a lot of the good blood sugar recommendations are still going to be helpful with someone who already has good metabolic health, so that you can maintain good metabolic health. So I hope that this was helpful to help better understand the big words that get kind of thrown around, and to kind of understand it as a little bit more of a spectrum, to like best blood sugar regulation to worst blood sugar regulation, and also understand why it might have some advantages to do this a little earlier on. When we implement things at more the insulin resistant stage, your insulin is working extra hard, but it is still getting the job done of keeping your blood sugar in a normal-ish range, which means that that damage to the pancreas from being in a high sugar state is just a lot less likely. And so it's a really powerful time and place to make powerful changes in your health. So I've created a free cheat sheet for you called Labs in Lingo, the Blood Sugar Edition. I am the founder of a free community called the PCOS Shift Society, and I'd love to see you in there. The link is below. And if you join, go to the classroom, you'll see the YouTube bonuses, and you'll have access to this awesome handout. Okay. Thanks for being here. I'll talk to you soon.